Borderline personality disorder is a mental health condition characterized by pervasive patterns of instability in mood, self-image, interpersonal relationships, and behavior. It usually begins during early adulthood and presents in various contexts. Individuals with BPD often struggle with intense fears of abandonment, rapid mood swings, and difficulty maintaining a stable sense of self. These experiences can be deeply distressing and disruptive not just to the person, but also to their families and loved ones. According to DSM-5, the presence of 5 out of the following 9 criteria makes a diagnosis of borderline personality disorder. Number 1. Frantic efforts to avoid real or imagined abandonment. For example, someone might threaten self-harm if a partner says they need space or a break, or panic when a friend doesn't respond to a message promptly. Number 2. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Imagine someone with this disorder start dating a new partner. In the beginning, they might view them as perfect, kind, attentive, as if it's the best thing that ever happened to them. They might become intensely attached and overly invested very quickly. However, if the partner forgets to call one evening or doesn't respond to a text promptly, the person might suddenly feel betrayed or unloved. This can trigger a switch to devaluation. They never cared about me, they're just like everyone else, or I can't trust anyone. Number 3. Identity disturbance. For example, the individual may feel like they don't know who they are, change careers or life goals frequently, or adopt the opinions and personalities of those around them to feel accepted. Number 4. Impulsivity in at least 2 areas that are potentially self-damaging. For example, reckless driving, unsafe sex, binge eating, overspending, or substance abuse, done impulsively, especially in times of emotional stress. Number 5. Recurrent suicidal behavior, gestures, threats, or self-mutilating behavior. For example, cutting, burning, or threatening suicide during arguments or times of perceived rejection. Number 6. Affective instability due to a marked reactivity of mood. This can be explained by mood swings that can shift from intense happiness to irritability or despair in a few hours, often triggered by interpersonal stress. Number 7. Chronic feelings of emptiness. For example, expressing that life feels meaningless or that they feel hollow or emotionally numb most of the time. Number 8. Inappropriate, intense anger or difficulty controlling anger. For example, explosive outbursts of rage over small slights, sarcastic or bitter communication, or even physical fights in close relationships. And number 9. Transient, stress-related paranoid ideation or severe dissociative symptoms. Under extreme stress, like during a fight, the person may feel detached from reality, feel like they're watching themselves from outside, or briefly believe others are plotting against them.